If you are thinking about having bariatric surgery and you're starting to look for a surgeon, you probably already have some questions in mind that you plan to ask. I'm going to tell you the questions that I wish I had asked when I was looking for a surgeon that might make a difference in your outcome and the surgeon that you choose. If I had known to ask these questions, I probably would have chosen a different surgeon to begin with. My name is Sean. I had a mini gastric bypass in March 2022, and I went through three different surgeons. I started with two different surgeons and switched. And then before I finally found the surgeon that I ended up with. It took me finding three surgeons before I found the surgeon who actually did my procedure. And if I'd known to ask these questions that I'm going to share with you, I probably could have saved myself a lot of time and some money. So I'm going to start with some of the questions that you might already have in mind. I just want to run through some of the more common questions, just so you know that you have them on your list, just so you don't miss anything. And then I'm going to go into the questions that I wish I'd known to ask. Okay, so let's start with some of the more common ones that you probably already thought of, but let's just check. The first one is, what surgery do they recommend and why? And the reason I bring this up is because a lot of people think that the choices are either a sleeve or a bypass. And there are other procedures out there available. And you want to explore all of your options so that way you get the best procedure for you to help you reach your weight goals and your health goals. So when you're interviewing a surgeon, ask them what procedure do they recommend for you and ask them why. The next question is, ask how long you're going to be in the hospital. How much time do you need to take off from work? And that's going to depend on what kind of job you have. It's going to be different, like if you have a desk job versus if you're on your feet all day or you're doing a lot of heavy lifting at work. You want to ask about activity restrictions. So there are probably going to be activity restrictions in terms of the kinds of exercise that you can do, and also again with heavy lifting or amounts of weight that you can lift. And ask how long those activity restrictions are going to be in place, just so you can start to plan to have some support and people around you for the time that you need. You want to ask about how to manage any prescription drugs that you're taking. There's some drugs that you're really going to want to coordinate on. If you're taking any GLP-1s like Wegovy or Ozempic or Mounjaro or Zepbound or drugs like that, then you might have to be off of those several weeks before that you have your bariatric surgery. So you want to ask about that. And then if you're taking any blood thinners, you're going to want to coordinate with the physician who's prescribing your blood thinner and your surgeon just to make sure everything goes smoothly. Then you want to ask about how the surgeon handles complications. So those are some of the more common questions that you'll want to have on your list. Now let's get to the questions that I wish I had asked. The first one is, do you want me to lose weight before I have surgery? Every surgeon has a different approach to this. Some surgeons say they want you to lose 5% of your current body weight. Some say 10% of your current body weight. Some say 5 pounds or 10 pounds. Some surgeons will say, just don't gain any weight before the surgery and you're good. It really depends on what the surgeon is comfortable with, what your current BMI, what your weight is, and your health. The real thing that you want to know is, if they want you to lose weight, will they help you lose weight? So if they say yes, they want you to lose weight before your surgery, your follow-up question is, what will you do to help me lose the weight? They should have some kind of diet program, access to a registered dietitian who specializes in obesity and bariatric medicine, maybe access to an exercise plan and a trainer or an exercise physiologist. Some surgeons will prescribe weight loss medications to help people prepare for having surgery. One or all of the above or some combination is a good thing. What you don't want to hear, or what is a red flag to me, is that they don't have any kind of support to help you lose the weight that they're asking you to lose before you have surgery. Like if they can't support you in having surgery, what kind of support are they going to have for you after your surgery? So that's the first question to ask. The second question you want to ask is, what is their pre-op diet plan or eating plan like? Again, every surgeon's different. Some surgeons, and it depends again on your health and your BMI and how much weight you have to lose. Some surgeons will want you to be on a liquid diet for weeks before your surgery. And it also depends on how quickly you're trying to have surgery. So some surgeons might want you to be on a liquid diet several weeks before you have surgery, or some kind of modified diet, like you might have to exclude some foods. You could eat solid foods, but you have to exclude some things. And some surgeons might want you to be on a liquid diet just a day before or 2 days before. What you want to look for is what's comfortable for you and what you feel like you can do. I get it, like it's never easy to do a liquid diet for weeks, but you want to know that you are able to set yourself up. You want to feel like you're able to set yourself up for success with that liquid diet. And if you feel like you're going to struggle, then ask them what kind of support they can help you with. Like maybe there's a health coach that you can work with who can help you like think through all the things to set yourself up for success. Or ask if there's a different approach. Or maybe go talk to another surgeon and just kind of explore your options and see if another surgeon might have a different approach for you. So that's just a gut check for you to see if they have a pre-op plan that you're comfortable with and you feel like you can accomplish. All right, the third question that you want to ask, and this one was a big one for me, is how do they envision you eating, or how do they want you to eat post-op? And there's two kinds of post-op diets. There's a short-term post-op diet, and then there's the way they want you to eat for the rest of your life. I'm talking about the way that they want you to eat for the rest of your life. But just to recap, let's talk about the immediate post-op diet. This is the diet that's going to graduate you from clear liquids all the way to eating solid food again. Every surgery program has a slightly different approach, but the stages are very similar, and the types of food you're eating on each of those stages is very similar. So there's a little bit of variation, maybe. I've seen it range from 3 weeks to 5 weeks, but it's pretty similar. What you want to ask about is, how do they want you to eat for the rest of your life? And you want to make sure it's something that you can live with. If you feel like you can't live with that, or you don't think that you can make the changes that you need to make and stick with it lifelong, then you need to either have a conversation with them about how can you adjust that approach so that it's something that gets you to success and improves your health while helping you find something that you can live with. Because if you can't do it, then it's not good for your health, right? Like if you're slipping all the time, or you're breaking off of that plan all the time, you're not doing any good for your health. So you need something that you can stick with. And so that's what you really want to look for. There are different approaches to meals. So some surgery programs want you to do a strict 3 meals a day. And some surgery programs want you to do very intentional, smaller meals throughout the day, like maybe 5 meals throughout the day that are very intentional. It's not snacking. They usually want you to pay attention to the composition of those meals. But they might have you eat more frequent meals. So you want to be sure that that's something that you can live with, whatever they plan there. And then the other thing is, will they accommodate the way that your food culture, your food traditions? I mean, we all get that, like, we can't eat sugary things, or, really high fat things, frequently. But if they can't accommodate your food tradition, like a group of foods that are part of the way that you like to eat, the part of the way that you grew up with, or the way that your family eats, if the way that they envision you eating doesn't accommodate that, that's a red flag. And that was important to me. So you want to ask about that and make sure that it's something that you can live with. Okay, the next question is post-op support. There's two kinds of post-op support. There's a short-term post-op support in the days and weeks after you have surgery, and then there's the long-term support. So they usually already have a plan for the immediate term post-op support. Getting dehydrated is a common thing, and so you want to see Is there some help there in case you get dehydrated, and what that plan looks like? Do you have access to a surgeon or some kind of physician or a nurse on call in case you have some complications immediately after surgery? And what does that look like? Can your family or your support people have access in case, they need to call someone on your behalf? So ask about that, but then also ask about the long-term post-op support. You want to find something again that you feel like is going to get you to the success that you're looking to achieve. My surgeon provides 5 years of support, so I can reach out to the program dietitian. I can reach out to the medical team if I have any questions. My medical team, my surgeon's medical team, will coordinate with my primary care provider or some of my specialists in case I have any issues. So, and that's a 5 year support program. So you want to find something that sounds good to you. The next thing you want to ask is, do they have a support group? Again, there's no real right or wrong answer. Again, you want to listen for something that you feel like will help you get to the success that you're hoping to achieve. For me, no support group was, or no kind of post-op support was a red flag. But again, find something that works for you. Some surgery programs have some kind of group. Virtual groups are really popular right now, especially after COVID. There used to be some in-person groups, and there might be some surgeons who still do that. And then there's surgeons who use social media, like a private Facebook group, or they might have, a private Slack group or a private school group or something like that, where people do peer support and it's user-generated support. To me, the best support groups are either in person or virtual. Virtual, I think, is easier for people to participate in. And again, I tried two different surgeons before I landed on the surgeon that actually did my procedure. So I saw what some of those different support groups look like. The best support group that I was a part of was one that was led by the program psychiatrist, who was also a bariatric patient. So he really understood what it was like. And it was a weekly support group, and it was very interactive. It was virtual, it was through Zoom, very interactive. So people were participating and answering questions and, sharing their experiences, but really targeting all those issues that come up after surgery. And you could participate for as long as you wanted to and as frequently as you wanted to. A lot of surgery programs actually require that you start attending support group before you have your surgery, and they may require that you attend a certain number of support groups meetings before you actually have your surgery. So you want to ask about those things. Another question to ask is, do they require a psychiatric evaluation, and what does that look like? Most surgeons in the US do require a psychiatric evaluation. Outside of the US, it varies. If they do require a psychiatric evaluation, the next question you want to ask is, do they help you get that psychiatric evaluation? Some surgery programs have a psychiatrist that's part of or a therapist or mental health professional that is part of the practice, so they're right there, and it's very convenient to set up an appointment with them. Some may have a list of psychiatrists or mental health professionals that isn't a part of the practice, but that they work with and that understand, how to do a bariatric evaluation. And so you can set up something on your own. And then some may say you have to find somebody on your own. To me, that's that third option is the red flag. The other thing that you'll want to know is, I found through all the different surgery programs that I tried, was that the psychiatric evaluation is time consuming in terms of getting set up for it. Like, there was a 2-month waiting period. And then depending on the outcome of the psychiatric evaluation or the conclusion, that may also change the timing of your surgery. If there's something that comes up in the evaluation that they want to work with you on, that might delay your surgery until you can work out that issue, so that way they feel like you're set up for success. So ask about that. The next question that you want to ask, if you're looking to have children, after your surgery, ask about what kind of support they will give you once you are trying to get pregnant or become pregnant. You want to make sure that they're going to help you adjust your diet and set yourself up for a healthy pregnancy now that you've had bariatric surgery. The last question on my list of things that you want to ask that I forgot to ask was, if you don't reach your weight goal or if you regain weight after your surgery, do they help you? Some surgeons are comfortable prescribing weight loss medication or working with somebody in their practice to prescribe weight loss medication to help you. For some patients, they may recommend a revision surgery. So, let's say, you have a sleeve, they may recommend a revision to a gastric bypass or some kind of switch, or they may do a combination of these therapies. It just depends on your health and what's going on. But you want to look for some kind of help if you, again, don't reach your weight loss goal or, you regain weight. You want to look for support that's not shaming but supportive. A lot of people feel like, and I'm going to do another video about this, but a lot of people feel like it's their fault or they messed up or they failed if they regain weight after surgery. But obesity is actually a chronic disease that's both progressive and relapsing. So sometimes regain can happen. It's not necessarily your fault. And you do want medical support if that happens. So you want to make sure that that support is there for you if you need it. So that's the list of questions to put on your list to make sure that you get all the bases covered, that you don't make the mistakes that I made, and that you have the support that you need. So if you want help getting ready for bariatric surgery, I offer one-on-one peer support calls to help you plan. I'm not a medical professional. I'm someone who's, like you, has been through bariatric surgery, and I'm a health journalist, and I've worked in an online weight loss clinic. And I want to help people succeed at reaching their weight goals. So if you want someone to help you understand what the different procedures are so you can make an informed choice with your surgeon. You want someone to help you understand what to do in case your insurance denies you, or what kinds of options to look for if you want to finance your surgery out of pocket, or if you're thinking about having surgery outside of the United States, how to find a surgeon. I can show you what to look for and where to look. Or if there's other things that are important to you and you just want support from someone who's been there, I offer one-on-one peer support calls. So if you look in the video notes, you'll see a Calendly link and you can book with me, find a time that works for you. The calls are 1 hour long. We'll focus on the things that are really important to you. And then after the call, I'll send you a personalized follow-up email with follow-up notes covering everything we talked about and a list of resources to help you. So you have a roadmap that you can follow and hopefully save some time and have a successful procedure and get mentally prepared and be able to prepare the people around you, your support team and your family and friends. So if that's something you're interested in, click the link and book some time with me, and I look forward to helping you.